Hi, my name is Barb, and I'm the mother of a boy with X-linked SCID. When my son was born, there was no way to know that he had this disease, which left him vulnerable to the simplest of infections. Today, an effective method to diagnose SCID from a simple blood spot exists. The HRSA Advisory Committee on Heritable Diseases in Newborns and Children has recommended that SCID Newborn Screening be added to the core panel of diseases for which screening should be performed in all states. Without a family history of the disease, SCID children are often not diagnosed until they are close to death, and in some cases, not until after they have died. Let me talk a moment about the quality of life for those children who are lucky enough to be survivors of this disease so far. I specifically want to talk about those children who, because they were not diagnosed as newborns, had to be so sick that they came to the brink of death before doctors could diagnose the problem. My son Ray is one such child. Ray is now 16 years old. Born seemingly normal, he thrived for several months until he caught his first cold. Within days of first entering my pediatrician's office with a child that I thought might have a virus, he was in the PICU and on a ventilator with PCP pneumonia. He spent 4.5 months on a ventilator, had 13 chest tubes, and was trached. He received his first bone marrow transplant at a year old while on the ventilator in the Duke PICU. An enterovirus ultimately caused severe GI damage. His GI tract never fully recovered, and he remains fed by enteral and parenteral means. Infection and graft versus host disease caused his graft to fail, and he has required 2 additional bone marrow transplants. He managed to come off the ventilator, and his trach was eventually removed, but he has severe lung damage and scarring, which significantly limits his ability to participate in normal childhood activities. All the infections had to be countered with multiple antibiotics, antivirals, and antifungals. Ultimately, we learned that one of the antibiotics used to save his life had also left him moderately to severely deaf, requiring hearing aids and special educational assistance. My son's medical costs maxed out a $2 million insurance policy by the time he was 5 years old. Though Ray survived when many have not, his life will continue to have many costly challenges which could have been prevented. Benefits of early diagnosis for him would have been a life without these ongoing costs and challenges. There are those who would argue that a false positive test for SCID would be too dire for the family involved. I disagree. I've asked other SCID families their perspective on this argument, and they were overwhelmingly shocked to learn that there was more concern for a family with a healthy baby who might be asked to repeat a test than for a family with a SCID child who might not learn of that diagnosis until after they had buried their child. SCID is a disease which cannot be seen or identified at birth without a blood test. Children with SCID are born looking and acting seemingly normal. A simple and reliable test for SCID now exists. We can easily identify those children affected with SCID before they contract their first cold. Without this early diagnosis and the now standard medical treatments, the damage caused by infections allowed to ravage the bodies of these children will cause irreversible damage and very often death. How many children must suffer a diminished quality of life? How many children must die before we say that it's too many? We have the technology, we have the science. We now need the prudence to step up to the plate and make SCID newborn screening a standard of care. Thank you.